So we are live. We are live for everybody online. We are here in Columbus, Ohio. We haven't been here since 2022, so it does feel good to be back. Our program is sponsored by Novartis Pharmaceuticals and TG Therapeutics, and we can't do these programs without them, so let's let them know that we thank them. Thank you. And we have our licensed clinical social worker, Jessica Salinas-Thomas. Jessica has done a lot of work for MS Views and News at our live programs, as well as also our virtual programs. Thank you for joining us, Jessica.
Good afternoon, everyone. Thank you, Stuart. I am Jessica Thomas. I'm going to be bringing a great topic, an important topic today. We're going to talk a little bit about really distinguishing between sadness and clinical depression. I'm going to talk about a range of different things that we may experience with MS. So this is a conversation worth having because depression is often comorbid with MS. It's not uncommon to have depression and or to have mental health, mood changes, et cetera. So we're going to talk about that today. So we'll move on to our next slide. So a little bit about me. I have the bee there. I feel like I'm a busy bee, but I'm like many of you. I live with MS, and so I always like to introduce myself in this fashion because I think it helps me to be relatable and explains my story. So 20 years is the amount of years that my husband and I have been married. So this year we'll celebrate our 20-year anniversary. 19 is the number of years that I have been diagnosed with MS. Of course, I had MS much longer before my diagnosis, but my diagnosis was about 19 years ago this year. And so you can tell I was a newlywed when I was diagnosed. I was also 26 years old. 18 is the number of years that I have been focusing on working with specifically with people living with disease. When I was diagnosed in my own journey, my own journey of my diagnosis led to a lot of anxiety, and it was very lonely and isolating, and I didn't know where to turn. And so I've always been a social worker since college, but I decided to really hone in and focus on working with people that experienced mental health and mood changes due to an illness. And I specifically have been focusing on MS and a little bit in the oncology field now too. And then 17 is the number of years that my son turned. And I share that too, because I had my son after my MS diagnosis. And I'll bring up teenagers and mental health too, just for a very little bit today. But we're going to explore the range. So I'm here to talk about the difference between sadness and all the way to clinical depression, and what does that mean, and why is it important to distinguish, and the reason why is there's much difference in the severity, the duration, the impact, and how it impacts our quality of life. So we need to talk about this now. As we work through today's program, I want to make sure that we are noting that we're not diagnosing ourselves, because I'm not giving you enough information to diagnose you, but I want you to start the conversation within yourself, and I want you to start the conversation maybe with your healthcare provider. And it's okay to talk about our moods, because our moods are a big part of our quality of life and our everyday experience. How we feel today mentally impacts how we experience our day. So we're going to move on to our next slide, and we're going to start off by talking about loneliness. So I hope that, so I'm in North Carolina today, and you're in Ohio, and some people are virtually. But my hope is that we're paying attention to if we're feeling lonely. Now, there's a difference between feeling alone and empowered and a sense of loneliness where you feel disconnected from others. And often loneliness can lead to feelings of depression and feelings of being disconnected, etc. So, and this can lead to a reduced quality of life. And this matters. So what you will notice in today's talk, that I'm going to share a little bit about something like loneliness, and then I'm going to also leave with a question: what is something that you could do to help if you're experiencing this? So people that experience loneliness you can have a house full of people and still feel disconnected. And feeling lonely is at an like really an all-time high, even though we can connect very easily with one another through technology and now that we're getting out of we're post COVID, support groups are coming back and other activities are coming back, but I want you to check in with yourself and are you dealing with loneliness? If you are dealing with any feelings of loneliness, what I want to let you know is that one, you're not alone. This is something that many people struggle with. But where is your power? And where your power is the question I'm going to leave right here. How can I connect with others? So if you are dealing with loneliness, one strategy question that I leave with you for loneliness is, how can I connect with others? And Stuart mentioned the monthly mental wellness chat. That is a great place to connect. And I encourage you to do that. But there's also many other ways, and it doesn't have to be MS related. It can be related to all sorts of different things. But how can you connect with others? Because connecting is important. We'll move on to our next slide. So when we talk about sadness, sadness is really a kind of a complex emotional state, and usually it is a response to an experience, thought patterns, and it can feel like a kind of just a low feeling, and you may have a experience of like unfulfilled desires or expectations, a sense of failure or loss, and most of the time, sadness is a feeling that would be temporary. Now, it's important to know if you are experiencing prolonged sadness that could, kind of topple over into other mental health challenges. So I would like to leave you with these questions. If you experience sadness, which we all do at some point of our life, I'm sure this week I've had a period of sadness. Next week, I'm sure I will too. Sadness is a normal emotion to feel sometimes. Prolonged sadness is not. So the question I leave for you with this is, if I have a sense of sadness, is there something that I can do in my thought process to help change or move through that feeling? Could I look at gratitude? Could I sit in my sadness for a little bit? That's okay to do that. But how can you infuse a little bit of joy in your life to help offset that feeling? Could it be a conversation with a friend? Could it be participating in art? Could it be reading a book or listening to a song that lifts your spirits up a little bit? Is it going in the sunshine for a little bit? But sadness should improve with time or circumstances, and it's just important to make sure that we're watching that it's not persistent. Next, we're going to move on to apathy. I talk about apathy quite a bit in the MS Mental Wellness Chat. And the reason why is because apathy often can exist with depression. And then sometimes apathy can just kind of sit alongside itself. And so apathy is really a sense of like a lack of passion or emotion. So the Greek word comes from a Greek word called pathos, and that means like a lack of passion or emotion. But when I think of apathy, I think of people that are experiencing kind of just a down feeling, but there's no motivation. They struggle with kind of doing the next thing that they need to do. They struggle with just feeling excited or happy. I also think about teenagers with this. Many teenagers, including my own child, sometimes can present as kind of apathetic. Just kind of nothing kind of moves them. They're just kind of they're okay, but they're just kind of apathetic. And everyone in their lives probably experiences apathy at one point or another. Now, apathy is something that there's not a medication that can treat apathy, but one of the best things for apathy is routine. And we talk about this on the MS Mental Wellness Chat quite a bit. And so developing routine and having a routine can kind of help carry you through the things that you need to do when you're feeling apathetic. Now, so my questions for you, if you can identify with a sense of apathy, what is something that you can do to create and maintain a routine? Because long-term apathy can also lead to more of a depressive psychological state. And depression definitely incorporates apathy. It's usually right there, hand in hand, side by side. But apathy doesn't always have depression included. So what we want to do is make sure that we're watching the apathy and making sure that we're watching that sense of like, just not feeling like doing that much. I'm not very motivated. I'm just not feeling very excited. And this is a good talking point to talk with your doctor. I know many years ago, and I always allow myself to be a little bit vulnerable. Not for me, but it's really for you. But many years ago, I was having a sense of apathy. I called my MS specialist. I had an appointment, and I said, I just want you to know I've been feeling kind of apathetic lately, and I just wanted you to know that. And I'm doing the things I need to do, but this is kind of a mood I've been experiencing lately that's kind of bothering me. So I encourage you to do the same if you're dealing with apathy. The next one that we were going to talk about, so we'll move our slide, is dysthymia. Now, dysthymia. So with dysthymia, this is more a lowness, a flat feeling. I want you to visualize Eeyore. If you're familiar with Winnie the Pooh, Eeyore would classically have dysthymia. He's very low, very flat, not very excited or engaged, has a lot of fatigue, not MS fatigue, this is mood fatigue, and which can be a little bit confusing. And we won't go into the details of this, but fatigue can, I know, affect both. They may have low self-esteem, feelings of just general hopelessness. You may have eating changes, etc. So you again may see this with teenagers as well, just not very excited. And one of the most important things with this level of mental illness is that, or mood change, is that how can you keep yourself from withdrawing? Because when you're feeling this way, you're not going to want to probably hang out with your friends, or you might not want to go to that dinner. You might not want to go to a social activity or do something that initially you planned to do and you thought it would be good, but now that it's here in front of you, you're not really wanting to go. So it's important to ask yourself, how can I not withdraw when I feel this way? And if you can remember Winnie the Pooh and his friends, and how they always include him, and they kind of make sure he always tags along. And the great thing that happens after that is that usually at the end, is his mood different? Not much more. He's still kind of flat. He's still kind of low. But you can see that it helped a little bit. It wasn't a big thing, but it helped a little bit. But it's hard to diagnose dysthymia because it's subtle in its nature, and this is a very common to be comorbid with have another illness associated with it. So this is something that is not uncommon if you're living with another disease that you could experience. So we're going to move on to our next. And here is adjustment disorder. Oh, actually, go back real quick. So if you can identify with a symptom, I want you to ask yourself, and I did ask this, but I wanted to leave you with this point. How can I not withdraw on days that I feel this way? So, okay, we'll move on now. So we'll move on to adjustment disorder with depressed affect. Now, adjustment disorder can have different affects, like an anxious affect or a mixed mood affect, which is also has depression and anxiety, but we're going to stick with just the depressive part. So adjustment disorder is when something in your life, a big change happens. I have seen adjustment disorder happen when people living with MS are applying for Social Security disability. That maybe they stopped working, that was a really big change, and they're starting the process of applying for disability. And that period of time is very stressful, and it can feel very intense, and then it's financially vulnerable. So there's a lot of pieces to it. But an adjustment disorder with a depressed mood would you're going to have some feelings or some symptoms of depression that are not severe, but they are going to be impacting your quality of life. So you may have times of feeling sad, tearful, feeling hopeless. You might feel tired. It might impact your appetite a little bit, your interactions with people. But adjustment disorder usually resolves within 6 months. So and that's a pretty fair amount of time for people that have adjustment disorder. So usually within 6 months that there's some level of resolve. So in working in therapy, you might be able to have coping mechanisms developed. You may have things in place, strategies in place. You may be taking a medication that might be helping too. But the truth is that by 6 months, you should feel, a little bit better. And that situation still might be present and you still might be adjusting to it. But the impact of the adjustment is over from that, from the mental health side. So, the question that I leave for you with this is, how can I seek help when a stressful time is creating a reaction like a depressed reaction? So if there's something really stressful in your life and it's creating a sense of sadness and an intensity in emotions and even a depressed state, how can I seek help? Because at this point, if you're feeling you have a depressed affect, we may want to talk to a counselor, and the counselor can, go on to recommend, to see a psychiatrist if needed, or, but talking to a counselor, talking to your doctor could be good too. But knowing that adjustment disorder usually subsides within, 6 months. But as many of you may know from the disability process, that process can go on for like a year or two. And so, but it's not uncommon to experience some sort of reaction when you have a big change. And so I leave you with that question: how can I seek help? And I'm going to answer a little bit of that. You can talk to your primary care doctor. You can talk and get a referral to a counselor. You can seek counseling on your own. You can talk to your MS specialist to get a referral to a counselor, a social worker. If you have access to a social worker in your MS clinic, please utilize that resource as well. And then there is loss and grief. So we'll move forward. Loss and grief is something that can cause sadness and sometimes can lead to depression. And it's a hard part of life. And it's a big reality with an MS. We often deal with a level of loss and grief when we are navigating our disease at first. If we have new relapses or losses, even if we don't have relapses and we have physical changes, physical losses, we may grieve those as well. There's lots of different types of loss and grief, and I'm just focusing on some of the ones that might specifically relate to MS. We may have anticipatory grief, where we kind of grieve a pending loss that that we're thinking about. It is not uncommon to feel sadness, to have even some emotional, change or thoughts or feelings, and then as well as having some physical symptoms attached to a period of loss and grief. And those experiences can really kind of be all over the map in terms of intensity. And complicated grief can be equally as difficult. So it's important to know, if you're dealing with loss and grief, one, it's a very normal feeling and emotion, but you don't have to do this alone. Sometimes the reactions to grief and loss can extend, and and it's okay to seek professional help during this time. With actually any of these symptoms, it's okay to have professional help, even if you're dealing with levels of sadness, how to deal with sadness. But I'm going to leave with you with this very question. If I'm dealing with loss and grief, how can I embrace this, but seek the help that I need? And again, I'm going to reinforce, that talking to your doctor, getting a referral to a counselor, making sure deepening your support group, your support system, and allowing yourself to know that sometimes having MS, will give you ebbs and flows of loss and grief throughout the disease process. We'll move on to our next slide. We're going to talk about seasonal depression. So this is something I've talked a little bit about in the mental wellness chat. I like to bring it up usually right before the fall comes, because I do see that many people can experience a level of seasonal depression. For some people, it is the lack of light, the lack of being able to do things outside. It can differ and vary for many people, but it's common. It's probably most common in the fall through the winter for many, and it can trigger depressive symptoms. So you may have like sadness or a more depressed mood. You may have a loss of interest in activities that you used to enjoy. You may have fatigue, changes in sleeping and your appetite patterns. You may have a hard time concentrating. And it's important to note that that seasonal depression is like, clinical depression in the sense that it's literally like clinical depression in many cases. But there are things that you can do to be proactive. When I was practicing therapy, I'm in a different role. I'm a director of patient education right now. But when I was a therapist full time, what I would do with the patients that we knew had seasonal depression is that we had a proactive stance to it. So we knew that the fall was coming up. Okay, what is the toolkit that we need? Is it, is it having access to therapy grade lighting? Is it having a plan for, the things that you're going to do, the social things you're going to do to stay connected so you don't withdraw? Is it making sure that we get up, a little bit earlier, move a little bit, more during the first part of the day so you have a little bit of more energy? 2 weeks or longer of experiencing depression when seasons change, or depressive symptoms, it's good to talk with your doctor about. And so the question I'm going to leave with you here is, how can I be proactive before the season starts to address this? It is so much easier. With seasonal depression, we often have a sense we know it's coming up and we know when it's going to come up. And managed depression is so much better than unmanaged depression. And when you're ahead of the curve and you're addressing depression sooner than later, it's easier to actually address as well. I even had therapy clients that would step up their counseling sessions during the fall and winter because we knew that their needs were higher during those periods of time. But how can I be proactive to address the changes in season and how I feel ahead of time? That is what I leave you with that. And then we're going to move on to depression. So a part of depression is to really, I guess, meet the criteria of a major depressive disorder. You really have to have an impairment, meaning you struggle to complete basic tasks like getting to work, getting up, taking a shower, brushing your teeth, not physically, but emotionally. These are the barriers. And this it impairs several domains of your life. And there also can be high functioning depression, where high functioning depression is some of the external signs are not there, but you might be able to, you have an appetite, but you don't enjoy food. You have, challenges with feeling less rested, but you do have a decent sleep pattern. You might have difficulty making decisions, even though you can make sometimes you can make simple, fast ones. Spending time with friends and family, yet you feel very disconnected. So there can be a level of functional depression, and I want to really just focus on with depression is that depression and MS kind of seem to be related sometimes. And sometimes it's because, having a chronic illness can lead to a higher susceptibility of having mental health mood changes. And living with a chronic disease is very challenging. If you are dealing with any of these mood challenges, but specifically depression, I want you to know that there are treatments, but also at the same time, depression and all these mood changes are very much like an iceberg. At the tippity top, people only see what they see. And if you are feeling, have, feelings or thoughts of depression, I want you to talk with your healthcare provider because they probably don't see it if you're not talking about it. Now, some of the things like, that your friends and family might see and might notice, but it is important for you to communicate with your healthcare team about what's going on inside of you and what's going on in that iceberg, because people can only see what's at the top. They don't see all the things that you're thinking and feeling below. And this is something that can be treated. When we treat depression, our quality of life improves. And that is really important because sometimes depression can be actually more disabling than MS can be as well. And so that's important to know. So the question I leave with you here is, how can I seek help as soon as possible to manage depression or get it evaluated if I don't know I'm dealing with it? And so think about who's in your healthcare team, your primary care provider, your MS specialist. They can help lead you to a counselor. You can definitely go to a therapist or seek that independently. But if you think you might be dealing with depression, you're probably dealing with one of the ranges I've talked about. And I urge you to get some supportive care, because the truth is that you deserve it. You shouldn't do MS alone, and you should not do depression alone as well. So we're going to move on to our next slide, and we're going to talk just a little bit about symptoms in depression and MS and kind of what do they have in common. And so both have fatigue. Both can have problems with sleep. So with depression, you can have problems staying asleep or sleeping too much. Same thing with MS sometimes. Problems concentrating. With depression, often people have problems and struggles with concentrating. And then also with depression or MS, you can experience this, or mood changes. So that can make it kind of fuzzy. Is it MS or is it depression? Well, if you're not sure, talk with your doctor about it. Move on to our next slide, please. We want to make sure that we are identifying our symptoms. What is the best way to do that? I always say, for me personally, I think the best way to do that is to track them. If we track our symptoms, we get to see kind of what's our baseline, what's our normal patterns, and what's not normal. And when do we see a doctor? We'll move on to our next slide. I would love for us all to integrate talking about our emotional health at our doctor's appointments. So to integrate telling your doctor how your mood has been. This is something I do with my MS specialist is really great about asking me too, but I talk about my mood as well. I make sure I do that because we want to normalize this, because often mood changes or mental health concerns are a part of MS. So what can I do to help manage these symptoms? Share with your healthcare team, express yourself by journaling, writing, staying involved, staying connected with others, attend a support group, sticking to a schedule and routine, getting plenty of sleep, eating well, taking medication. Medication compliance is a huge part of this often, and doing things that give you a small sense of joy, learning resilience behaviors. And we talk about these constantly in the mental wellness chat. Remember, how you start your day matters. And so, start your day with healthy habits. Think about a routine, be consistent with yourself. I know MS is inconsistent. It's inconsistent for me too, but there are a couple things I can control in how I manage and go throughout my day, and thinking about the things that I do as I journey through the day. Do they help foster emotional wellness, or do they help weaken emotional wellness? And then how do you end your day? That matters too. Thinking about healthy habits, thinking about what you can do to have really good sleep hygiene, to wind down. Often when we lay down, that's when our brain kind of wakes up if we're dealing with anxiety or depression sometimes. And so thinking about what can you do as an evening routine that will help support emotional wellness for you. Having things to look forward to. This is incredibly important. Little tiny things. I am looking forward to going to pick out a very small bouquet of flowers today from Trader Joe's. It's like $3.99, and it's one of my favorite things to do on the weekend. Also, a big thing, finding big things to look forward to. But the big things are hard to plan for sometimes, and so little daily things, developing things to look forward to, knowing that those things that you do create an upward spiral. So if we start the day off in a good way, and we're more apt to, like, if I get up and I make my bed, then I'm apt to do another little healthy behavior pattern. Or if I get up and I take a walk, or practice meditation or writing, then I'm probably going to do another healthy thing. We tend to spiral up when we do things that are good for us. So I am going to turn it over to questions.
Awesome. Thank you very much, Jessica. Everybody want to say thank you? Say thank you, Jessica. There you go. They're all saying thank you, Jessica, and clapping, all right? In my hand, I have some questions for you. First one is, the person feels lacking motivation. What do they have to do to help with that lacking of motivation?
Okay, so we talked about lacking motivation as a part of a lot of the ranges that we talked about. But if you're lacking motivation, I'm going to put this towards apathy a little bit. That, to me, that's feeling kind of apathetic. So there are some things that we can do that we know that are proven to help with lacking motivation. Often when we do something, we feel better, a little bit better at least. And so that's what we're aiming for. We're not aiming for to feel amazing because we did it. We're aiming to just kind of be able to kind of work through things. And so if you're lacking motivation, I completely am going to reinforce the idea that we should have routine and structure, and then a level of accountability. So maybe there's an accountability buddy, or someone that you love that is going to join you at something. Or we can't do that for every aspect of my life. Like, I can't have an accountability buddy for certain levels of things that I do myself, but what I can do is have a routine and structure. And when I build in that routine, like, for example, I'm more successful with exercise if I have somebody that's going to exercise or walk with me. But I won't always have that. So then what can I do to fix that? Well, one of the things I can do is that I can make sure that I program it into my routine to do it. And I let my routine drive my behavior, not my mood drive my behavior.
Great. Thank you. Next person writes that he or she is working in a very stressful environment with his or her MS. And what is possible to do to step down?
Yeah. Stress is going to be around us, right? And stress and MS are not really good friends. Yet stress is always going to be around us. So what can we do? If you're working a very stressful job, I like the mindset of what can I do to control the stress around me? How can I impact what changes could I put in place to help deal with some of the stress? I'm not going to say stop working, because, for some people, for myself, even that wouldn't be possible right now. But it's important to know, what can I do to control the level of stress that I'm experiencing? How can I help navigate that within my environment? And then beyond that, looking at, is this job compatible with my disease, in the sense of my stress level? If you're not able to, if you do everything you can do, and this is just a very high impact, high stressful job, then to maybe consider what are some other opportunities.
Okay, next one.
I would work with a therapist.
What's that?
I would work with a therapist.
That's true. Thank you. Next, if one has no history of depression prior to MS being diagnosed, but after the diagnosis, that person is actually diagnosed with depression, is that considered clinical depression? And if so, is it treated like a new or worsening new symptom that could cause a relapse?
Okay, I'm going to try to answer that. So it is not uncommon. It is not uncommon to not have a history of mental, of a mood disorder, but then have one after a diagnosis. That is not uncommon. I know for myself, I was diagnosed with anxiety after my diagnosis, but I had never had anxiety before. It was maddening to me, and I didn't understand it. Depression is not going to worsen your disease, but it worsens your quality of life. And when I say depression, I'm meaning untreated, unmanaged depression. And so it's not bad to have a diagnosis of anxiety or bad to have a diagnosis of depression. It may, for me, I carry anxiety as it's a part of, same way I'm wearing orange for my MS. It's a part of me. But untreated, unmanaged can have long-term consequences, and that is that's the more challenging piece. And so I would urge you to you don't have to embrace the depression, but treat the depression, because that can help your quality of life.
Okay, thank you. Any other questions? Anybody out there? How about you? Any questions? Okay, then Jessica, we have completed. Thank you very much for joining us today. And by the way, before I let you go, there is a person online that wanted to thank you for doing all that you are doing online, and that she would like to see this continue onward forever.
Oh, thank you. We are a strong group of people. We need to continue to focus on mental wellness too, and always know that we're not alone. So I hope the mental wellness chat does continue forever as well.
Okay, awesome. Thank you, and thanks for coming on.
Thank you. Bye.
I want to thank you all for being here today. We cannot do these programs without you. Again, I want to thank our sponsors, Novartis and TG Therapeutics, and we look forward to seeing you in October when we'll be back, but we'll be on the south side of Columbus, all right? Thank you. Have a great day.